How have you been feeling lately?
Honestly, not great. I've been feeling down for a little while. I don't have any motivation to do anything right now.
I'm sorry to hear that. It sounds like you've been under a lot of pressure. How long have you been feeling this way?
It's been going on for a couple months now. I feel like I just don't have any energy for anything. I'm not really enjoying anything right now. I used to love playing video games and working out, but lately I just don't find any enjoyment in doing any of those.
It sounds like you're losing interest in a lot of things that used to bring you joy. That's often something we see in depression. Tell me more about how you've been sleeping and eating.
I haven't really been sleeping much lately. Even when I do sleep, I just feel like I'm still really exhausted. I also haven't really been eating much lately.
Those are also some common signs of depression. What would you rank your self-esteem on a scale of 1 to 10 lately?
Honestly, I'd probably say it's a two right now.
It sounds like you're being really hard on yourself. Depression can often make us have feelings of inadequacy, even when that's not the case. These feelings can be hard to manage on your own, but acknowledging them is an important first step.
Honestly, I just don't really know what to do about it right now. I just really feel stuck.
It's understandable to feel stuck, but there are some things we can do to help. From what you've told me, it seems that you might be experiencing a depressive order. This is a condition that can affect your mood, your energy, and your thoughts, making it feel hard to be yourself and participate in actions you enjoy doing.
So what does this mean for me?
It means that you're experiencing not just being sad, but rather a clinical condition that can be treated. There are several treatment options that can be really effective. One common approach is therapy, where we work together to help change the negative thought patterns and find healthier coping strategies. Another option is medication through antidepressants, which can help balance chemicals in the brain that affect your mood.
But all these medications, do they actually help me?
Yeah, antidepressants can be effective for many people. Though it might take some time to find the right one, the goal is to reduce symptoms and help you feel better so you can engage in life more fully. Often, a combination of therapy and medication works best. Therapy will help you address the thoughts and behaviors that come with depression, and medication can support those changes by lifting your mood and energy levels.
Okay, that's good. I'm open to trying whatever can help me get better.
I'm glad to hear that. We'll take this one step at a time. I'll be here to support you through your process. We can start by exploring therapy techniques, and I can also refer you to a psychiatrist who can evaluate if medication might be helpful for you. How does that sound?
That sounds good. It's reassuring to know that there are ways for me to get better.
Absolutely. Healing is a journey, and I'm here with you every step of the way. We'll start with where you are, and we'll work through it together. Sound like a plan?
Yes.
This patient was showing symptoms of depression, so we used the medical model of psychological distress to begin diagnosing and treating her. Mental disorders like depression is very prevalent in today's generation and should be treated appropriately.
The medical model is a set of procedures and assumptions that guide how doctors treat patients and is used to understand the causes and treatments of physical and psychological conditions. The medical model says that mental health disorders are caused by physical conditions such as genetics, neurotransmitters, and brain structure. It uses the same framework as diagnosis and treating physical illnesses. The medical model was created to diagnose and treat mental health disorders.
A benefit of the medical model is it provides a framework for the diagnosing of mental health conditions. Some of the common mental health conditions prevalent in society today include depression, anxiety, bipolar disorder, schizophrenia, and obsessive compulsive disorder. Through the medical model, mental health professionals are able to categorize the symptoms, analyze the root cause of the disorder, and understand possible treatment options.
These treatments could include talk therapy with a mental health professional. Through talk therapy, professionals can help their patients identify and change troubling emotions. Another popular treatment for many mental health disorders are medications, which are often used in a combination with other treatments. The use of medications can help relieve stress symptoms in a patient. Taking medications can give validation to a patient that their mental health disorder is real and is not their fault. This reduction of self-blame could help someone's mental health and or physical suffering. Treatments are a big benefit in the medical model as they provide both support and even a possible cure to people with mental health disorders.
Another benefit of the medical model is decreased negative stigma within society. Historically, mental health disorders were treated very harshly. Mental health conditions have previously been framed as personal failings. However, as knowledge and medical technology advance, health disorders are taken seriously and can be treated appropriately. For some individuals, mental health disorders are framed within the same context as physical illness.
The medical model has several limitations. It leaves out many factors that can affect the overall well being of someone. These can include social, psychological, and the subject's environment. Leaving out these factors can lead to the subject feeling dehumanized. Also, ignoring social factors such as race, gender, and class can lead to a misdiagnosis. Another limitation to this approach is that it prioritizes treatment over prevention, which doesn't necessarily address the root cause of the disorders. Lastly, the high cost of advanced medical care can make these treatments inaccessible to many people.
Additionally, other social systems can cause psychological distress in someone. These social systems can include one's family, school, and/or workplace. Parental pressures can often significantly impact a child's mental health, often shaping their self-esteem and impacting their childhood development. For example, in school, students often can experience intense academic pressure, bullying, and/or social isolation, which can contribute to mental health disorders, including anxiety and depression. Similarly, in the workplace, many different factors can cause and contribute to a mental health disorder. These things can include stress caused by a high workload, a toxic work environment, and a lack of meaningful work.
Clinical psychology is a specialty area of psychology that focuses on understanding, preventing, and treating mental and behavioral health issues. As technology slowly advances and professionals are able to identify and understand mental health disorders better, the treatment process also gets better. Clinical psychology should proceed forward in the future as ability to identify and treat mental disorders continue to get better.